Hi, Dr. Ian, and installment 3 on Ortho for Health. And what I want to talk about is the effect of jaw positioning on craniofacial pain. Now, as we've explained in episode 2, that the neck posture will change due to restriction of the airways, and this results in the head being positioned further forward in front of the fulcrum, which is basic physics will tell you that as soon as you go in front of fulcrum, a lever action. So what that happens is, to get balance, we need more pressure and tension on these muscles at the back, and to get a balance. And this will tire those muscles out as the byproducts of metabolism builds up in those muscles, and that can lead to spasm and pain in itself. And we see so many of these patients come in with muscle spasm and muscle pain. And headaches can result from this to a large extent due to this muscle activity tiring out those muscles, leading to higher pressures. This could also be linked to migraines, although this topic is quite controversial. And then the other reason for the muscles tiring out is malocclusions, or literally positioning of the teeth not being in natural balance, and there might be a point where the teeth just don't touch naturally. And think of it like a piece of chicken stuck in between your teeth, and those muscles will kind of work at trying to get rid of that piece of chicken in there, and will work at it and work at it and work at it, kind of gnaw at it. And the muscles will do the same if there's one of those spots where the teeth are just not touching properly, and they will either knock it out, break it off, or grind it down over time to get that freedom of movement and that balance. So the muscles kind of do the same thing as with the neck positioning and get overtired and go into spasm due to that irritation. So this muscle effect in itself can cause pain, but it can also cause a effect on the jaw joint, where this increased pressure can cause structural changes on the jaw joint, and that in itself can cause pain in the jaw joint. So temporomandibular joint pain, or TMD, is an obvious consequence then. Most TMD is a result of pure muscle tired, where we get trigger points where the muscle, for instance here, that gets tired can fire up pain there. So you have a different cause in a different structure, feeling pain somewhere else. But over time, that joint degeneration itself can cause pain. And the other cause of pain in this area here, in the craniofacial pain, is with restriction of the jaw joint. As the top jaw restricts the lower jaw, there's an increased backward pressure on this jaw joint. And literally what can happen is that the jaw joint, having to have a position like this, as that force comes back, the jaw joint kind of reacts to it and changes shape. Now that literally changes the whole function and movement of this jaw, as this jaw joint needs to, with jaw opening first, rotate and then translate along a axis and a slide plane of the skull. Now with that being the case, that's kind of restricting that movement. So the restricted movement in itself can cause quite a bit of pain. So this is how the jaws and the positioning of them can have an influence on the muscles and an influence on the bone, and that could be part and parcel of the craniofacial pain over a large extent. Thank you for watching.